first thing you're going to do in your cardiac assessment is you're going to look for jugular venous distension on the sides here, the jugulars, to see if they're distended, okay? Then you are going to palpate the carotids, okay?
I'm going to back
But you're
up,
only
Teresa.
gonna-
The first one is inspect chest wall.
Oh, okay. Inspect chest wall.
So what are you guys going to be looking for?
It's a barrel chest. or
Barrel
anything.
chest, symmetrical, okay? Make
Okay.
sure there's no lesions or anything on the chest. Sometimes patients do have skin breakdown.
Okay. All right, sorry about that. Okay, so first one is inspect chest wall, as she said. Then you're going to look for jugular venous distension, okay, on the sides where the jugulars are. And you could tell if they were distended. It's pretty prominent.
Normally,
You'd
you
be
would
able
want
to
the
tell.
head of the bed at 30 degrees, or you would want the patient laying down.
Okay.
And that's how I expect for you guys to do it in your exam. So if your patient's sitting, you're going to actually have them on the bed and have them sit up at a 30-degree angle. And I think we can move those beds up, even that one we do a little bit.
The head of the bed.
Yeah.
Yeah. Okay, and then you're going to inspect, and you're going to palpate the carotids, but remember you never do both carotids at once. And you'll check both of them, and then to listen for carotid bruits. On there it said the diaphragm, but you actually use the bell to listen for bruits. So you're going to take the bell of your scope and listen right at the carotids. Okay, so you're listening for bruits. Okay. Okay. All right. And then next you're going to,
And you would say, sorry, Teresa.
oh,
No bruits auscultated, okay? No bruits noted is what you would say out loud to me.
okay. And then you're going to listen to your heart sounds, your cardiac sounds in the 5 areas. So the first one you're going to listen to is the second intercostal space to the right of the sternum.
And I want you guys to verbalize second
that
intercostal
is-
space,
And that is the aortic area.
aortic.
Then you're going to go to the other side, to the pulmonic area.
So that would be second left intercostal space.
Second left intercostal
pulmonic.
space. Then you will go down to, I won't go, the third intercostal space, which is Erb's point, and you'll listen there.
That's the best area, and you'll learn this in the lecture next week, to listen to murmurs. That's one of the best areas.
Okay? And then the fourth intercostal space, which is the tricuspid
Cuspid.
area, where you hear the tricuspid. And then your point of maximal impulse, which is the fifth intercostal mitral.
In the video, it
mitral
showed you
area.
6 areas, because there's actually 2 mitral, but we're only teaching you that one
The
area.
5 and 6 are
Mhm.
the mitral areas. So, and then after you listen to heart sounds, sorry, I have to.
Locate the apical impulse, which you will say
Which you
out
already-
loud, which is
with
the
your
5th
hand.
intercostal space,
This
point
is
of
what you'll
maximum impulse.
You put your hand there where you can feel it.
And if you don't
Okay.
feel comfortable, all you have to say is verbalize to me where it's at. If you don't feel comfortable, because usually with women, you have to lift the breast up. To actually, it's easier on men.
Okay, and then you're going to check your radial and brachial pulses. So your radial is the outside here.
Where's the brachial, you guys? Where? On the inner aspect, okay? I've had a lot of students try to get the brachial out here.
Right.
It's not here.
It's on the
It's on the
inside.
inside.
Okay. And you'll do the same thing over on this arm, the radial, and then the brachial.
For the purpose test, it's going to be just one arm, you guys,
Yeah.
because it takes too long to do both areas.
And then you're going to test capillary refill, so you're going to press down on the nail bed to see how long it takes for her color to return.
2 to 3 seconds.
Yep. Okay. And that's it for the heart.
That's it?
Yeah.
Wow.
That's
When
it.
you guys do your radial and brachial pulses, I want you guys to pretty much state, radial pulse, either +2 and +3 is usually what's normal, right, Teresa? If I'm not mistaken. So you can quote those 2 numbers, or you can say palpable and no abnormalities noted. But usually +2 or +3 are what's normal for pulses. And then capillary refill is what? What's normal, you guys?
It
Less
comes
than
back in
3
2 to 3 seconds.
I think it's 3 to 5 seconds.
Yeah. You can say 3. Okay,
Yeah.
I'll accept 3 because that's what we're normally taught in school. And that's it. Let's go to lungs.
Okay.
Lungs